All right, let's tackle one of the most intense areas you'll ever face in nursing: critical immunologic disorders. We're going to see how a solid framework can take pure chaos and turn it into crystal clear action.
You know, when a patient's immune system goes haywire, you won't have hours to figure things out. We're talking minutes. The situation can go from stable to a full-blown crisis, literally in the blink of an eye.
So you're standing there thinking, is this anaphylactic shock or is it sepsis? And that one decision right there in that moment, that's where lives are saved or lost. The stakes, they're as high as they get.
And that is exactly what this is all about. This is just a little sneak peek into how the CSMRN framework gets you ready to make those game-changing decisions under immense pressure every single time.
So what's the real problem here? What are we trying to fix? Well, it's that age-old gap, right? The one between memorizing a textbook and actually knowing what to do when a real patient is crashing in front of you. So where do we see people stumble? It's always these same key areas. Like, how do you tell the difference between a crisis that hits you like a ton of bricks versus one that kind of creeps up on you? How do you catch those tiny but life-threatening drops in blood pressure? And hey, when all the alarms are blaring at once, what do you do first? That's the real test, isn't it? And this right here, this is the heart of the problem. Seriously, you can memorize the definition of sepsis until you're blue in the face, but can you walk into a room and spot it in a patient who's just a little confused, whose heart rate is just starting to climb? That's the disconnect we're here to fix. Okay, so how do we bridge that gap? How do you go from memorizing to acting? You need a system, a mental roadmap to organize all that chaos. And that's exactly what the CSMRN framework is. Let's take a look. Boom! Right away, this table brings some serious clarity. Instead of just a jumble of diseases, you immediately start seeing the patterns. Just look at the onset. Anaphylactic shock? Bam, it's rapid. Sepsis? It's progressive, it builds. AIDS? That's chronic. This is step one in the framework. You're sorting the crisis by its timeline and its main threat. Are we dealing with a massive allergic reaction, a body-wide infection, or a total breakdown of the immune system? Nailing this right from the beginning, well, it changes the entire game. All right, enough theory. Let's put this framework into action. We'll run through a couple of quick-fire scenarios, the kind you'll see on your exams, and more importantly, in real life. Okay, picture this. You walk into a patient's room, and this is what hits you. Their BP is tanking, their skin is bright red, and they are gasping for air. What is the very first thing that pops into your head? And right there, you are at a critical crossroads. Your brain is racing. Is this the systemic infection, sepsis, or is it a massive explosive allergic reaction? The patient's life literally hangs on you picking the right path and doing it fast. And this is where the CSMRN pathway just cuts straight through all that noise. Step one, you recognize that rapid onset. It's tied to an allergen. That immediately shines a spotlight on the biggest threat: airway and circulation. Suddenly, your priority isn't just clear, it's screaming at you. Airway now. Reverse the shock now. Okay, let's switch gears. Scenario number 2. You've got a patient with a confirmed infection. They've got a fever, their heart is racing, and now they're starting to get confused and their blood pressure is sliding. What's the pattern telling you now? And here we are again at another crossroads. Is this just the infection doing its thing? Or has it crossed a line? Has it exploded into a full-body inflammatory meltdown? That confusion, that low BP, those are the alarm bells. So the pathway lights the way. You see the progressive signs building on top of that infection. And that confusion and low blood pressure, that's not just a symptom, that's a giant red flag for organ hypoperfusion. It means the organs, the brain, the kidneys, are literally starving for oxygen. So what's your priority? It shifts instantly. We're talking aggressive resuscitation to save those organs. So if you look back at what we just did in those two scenarios, what was the common thread? We were using a simple but incredibly powerful formula. And here it is. This is the secret sauce. Recognition plus interpretation plus prioritization equals success. It's not about what you've memorized. It's about seeing the patterns, understanding what they mean for the patient, and then knowing what to do first. This is the formula that crushes exams. And way more importantly, this is the formula that saves lives. So when it comes down to it, this is what CSMRN is all about. It trains you to move past just memorizing facts. You learn how to connect the dots, to see how a patient's vital signs are telling you a story about their risk.
You learn to see the big picture and make those gut-wrenching, life-saving decisions with total confidence.
Because let's be real, knowing stuff is great, but in a crisis, if you can't act on what you know, it's useless. And that's our promise. We're not just giving you information, we're building that deep clinical judgment that lets you step in, act on what you see, and shut down a crisis before it ever has a chance to become fatal. Look, what we've talked about today, it's really just the tip of the iceberg. This was just a quick preview of the kind of clarity and confidence the full framework offers for these incredibly complex situations. So I'm going to leave you with one final question. When that crisis hits, and believe me, it will, when that patient is looking at you and the clock is ticking down, are you going to be the nurse who just knows the definition? Or are you going to be the one who's ready to act?